Hi there, my name is Gwen Rich. I'm owner and designer of the Gwen Marie Collection. So this is just another little short video to tell you part of my story. You can put all the videos together so you can get the whole picture of why I am here today and why I work passionately every day with the Gwen Marie Collection to not only raise funds for breast cancer research, but all about raising awareness for breast health education. So my story starts 1 month before my diagnosis, which is in September of 2012. And this is the time of year when I get my yearly mammogram. I've been getting mammograms since I was 35. I was someone who have been getting fibroids since I was in my early 20s to my mid 30s. And, my doctor recommended that I start getting my mammograms about 5 years earlier than the average female. So instead of 40, I was getting a mammogram at 35. And I was always getting the mammogram at the same place so they could always compare the results. But here we are in September 2012. I was at my mammogram visit. I let the technician know that I was concerned that one of my breasts had swelling, and I wanted to make sure that was nothing I should be concerned about. She verbally communicated to me that it was probably just because I was ovulating, and that can happen to women sometimes. Okay. And then, of course, when I called back a week later to get my mammogram report results, they assured me that everything was fine and I didn't need to worry. Everything had came back negative. So then how do you think, okay, 1 month later, I'm then diagnosed with stage 4 metastatic breast cancer. So stage 4 is when the disease has spread to the bones or somewhere else. So how can that happen in 1 month? Well, obviously, in my case, we can go back into some records. I have an old MRI where there is a spot on my vertebrae in 2004, which would be the spreading of the cancer, which was misdiagnosed for 8 years. But more importantly, you need to know is that at least for 8 years I've been having my mammograms, and every mammogram came back that I was fine. So this is where we women need to educate each other. We need to take notice. I was someone who had dense breast tissue. I was not aware of that. Women who have dense breast tissue are at a greater risk for breast cancer. So you need to have a conversation with your doctor. You need to have your mammogram yearly. You need to have the conversation with your doctor if you have dense breast tissue. And then it's up to you to decide. You really should get some 3D imaging. And so depending on where you're going, each facility has different 3D imaging. It could be an ultrasound, it could be a whole breast imaging, it could be an MRI. You need to have tests done to rule out that you don't have breast cancer. And that's really, really important. You need to make sure you have that conversation with your doctor. So hopefully after this video, this will cause anyone to take action if you're not getting your mammograms yearly. Hopefully take action to have that conversation with your doctor. Do you have dense breast tissue? And if so, go get some 3D imaging. So make sure you have that conversation, schedule your mammogram, and of course, girls, we can work wonders just by talking to each other. So have a conversation with the girlfriends. Make sure your girlfriends are doing all the right things as well and are getting their mammograms so that we can stay ahead of the curve and hopefully beat those odds and not get a late stage diagnosis. So thanks so much for listening. Take a look around, shop the collection, and just thanks so much for listening. Bye-bye.